Hello, my name is Melissa Danilov. I'm currently completing my clinical rotation in adult behavioral health at Prisma Health Baptist, where I focus primarily on patients with psychiatric illnesses or behavioral problems that could cause a danger to themselves and or others. A typical nurse ratio is 1 to 5 with a max of 6. We don't currently accept new patients that have a known COVID infection. They are tested for COVID prior to being considered for admission. If we end up having a COVID infection diagnosed in our unit, we follow protocol by closing the unit and testing all patients and faculty. The unit would reopen in a week if no new diagnoses were made. I had the opportunity to assess psychiatric patients on their mental status and make nursing notes on their progress during their hospital stay and implement psychotherapeutic nursing interventions. I would like to take a moment to introduce a patient of mine that I will be focusing on today. My patient is an African American male who was involuntarily admitted to our unit due to an overdose on a whole pill bottle of his sister's medications that are unknown. He was admitted on October 16th after being at the ER. The patient called 911 after ingesting the pills and stated that he does not want to die and needs help. And then later he did say he wants to die. It was a little back and forth, but he currently lives alone near his parents. He is a tattoo artist. The patient stated that he has quit using substances including cocaine, alcohol, and marijuana 3 days prior to admission after discovering that his current girlfriend is pregnant and having an argument with her. The patient did test positive for cocaine and marijuana and states that he will need a nicotine patch because he also smokes cigarettes daily and he has not quit that. The patient stated that he doesn't know the meaning of his life and just wants it all to end. He voiced concerns that he won't be able to support his girlfriend as he is not in a good mental spot. The patient currently has 2 kids, 2 and 9 years old, with an ex-girlfriend, and those 2 kids live with the mother in a different home. Yeah, and his diagnosis is major depressive disorder upon coming into the hospital. And he has a history of fentanyl overdose in February 2022 that required hospitalization and Narcan.